There are several non-surgical options that patients have to improve their face, skin, loose skin, and how their face presents. Some of these we offer at Mohd Plastic Surgery and some we don't. An example of this is a thread lift, which some of our patients request and ask for. It's where a barbed suture, which is a suture that has little prongs that stick in the tissue as you pass that through. It's used by some practitioners where it's inserted in the face as a loop and tied. And what that does is it does lift the face, but it's a dissolving suture, often inserted blindly, which means one can't be sure of how deep it is and whether it's near nerves and so on. And it lasts quite well, but only until the suture dissolves, and unfortunately after that the result is lost. As a specialist plastic surgeon, it's not something we offer in our practice. We find it can be a dangerous thing. We've certainly had patients who've had this in the past. And when we do a facelift, there is a plane below which we don't go, or we try not to go, which is where all the nerves are. And we often find the threads are actually inserted quite deep, which is a bit scary because it tells us that the person putting them in may not have actually known where they were. And really for the patient, it introduces scarring where you don't want scarring to be, and a result that wasn't long lasting. So patients like that will usually benefit from a lower face and neck lift. We talk to them about what that procedure involves, which usually scars that are concealed around the ear. It takes about 5 hours with an overnight stay. That's a reasonable operation, but the results can be really dramatic. It really defines the jawline. In terms of the neck, that's actually the only procedure I feel that works very, very well. And with some downtime, probably about 2, maybe 3 weeks, the patient's actually very presentable, and the results are really long lasting, and for the right patient, it's a really excellent operation.